Application of reusable electrodes for recording a resting ECG in the 12 standard leads. This procedure is described in the guidelines of the Russian Society of Cardiology, which were published in 2023 in the Russian Journal of Cardiology. The issue is available for free download. Before applying the electrodes, it is necessary to ensure that the electrodes are clean and functional and to prepare the skin. If the electrodes have damaged coatings, they must be replaced, and if they are dirty, they should be cleaned, preferably with an antiseptic, according to the standard operating procedure of the medical organization. To process reusable electrodes, they must first be removed from the patient's cable conductors. Under no circumstances should electrodes be processed while connected. An antiseptic is used for processing. The most important thing is to ensure that the liquid antiseptic is intended for the treatment of medical devices and does not damage the electrodes. Next, the antiseptic is applied to the electrodes. A certain exposure period is maintained, which we have naturally shortened here. Then the electrodes are simply rinsed with water. After that, they are placed on a towel to dry. It is convenient to connect the electrodes to the patient's cable conductors before applying the electrodes to the patient. Therefore, in this case, we use silver chloride electrodes with button fastenings and the most suitable patient cables for them, which have so-called grabbers instead of connectors. When installing reusable electrodes, in some cases, the skin needs to be treated. The easiest way to do this is to use a regular antiseptic wipe, commonly known as a pharmacy injection wipe. Wiping, however, is done quite easily and does not require much effort. Accordingly, the electrodes are placed on the inner surface of the forearm in the middle third area, and on the shin, again on the inner or medial surface of the lower third of the shin. In this case, treatment is not required, although we will perform it. For high quality electrocardiogram recording, we need to use a factory-made conductive medium. It can be in the form of a gel or a spray, as in this case. For limb electrodes, it is more convenient to apply the spray by spraying it directly onto the electrodes. After this, the electrodes are placed on the corresponding limbs. I start placing the electrodes from the right leg because the right leg is the potential equalization circuit, making it easier for the electrocardiograph to handle interference. Now I will place the electrodes on the arms, and we will see that the signals about electrode disconnections have stopped registering on the electrocardiographic system. A fundamentally important point is the placement of the electrodes on the chest. The fact is that shifting them up, knee, or down leads to changes in the electrocardiogram. Pattern in the chest leads. Therefore, it is crucial to determine the position of the fourth intercostal space. For educational purposes, we demonstrate this with the patient in a sitting position. There are different ways to determine the position of the fourth intercostal space. The most foolproof method is determining the position of the fourth intercostal space from the jugular notch of the sternum. We palpate it, move down to the sternal angle. In adults, this is the site of the fused sternal joint. At its level is the second rib. Immediately below is the second intercostal space. Then the third and fourth intercostal spaces, where the electrodes C1 and C2 will be placed. Determining the position of the fourth intercostal space relative to other anatomical landmarks can lead to errors, which in turn can disrupt the ECG pattern. in the chest leads. We remember the anatomical landmarks, and here it is more convenient to apply the conductive medium directly to the chest. It is advisable to warn the patient in advance that it might be a little cold. After this, we remove the conductive medium and start with electrode C1. We place it in the fourth intercostal space at the right edge of the sternum. Then we take the yellow electrode C2 and place it in the fourth intercostal space at the left edge of the sternum. Next, electrode C4 is placed along the mid-clavicular line in the fifth intercostal space. I remind you that it is essential to orient yourself by the clavicle, not by any other anatomical landmarks. Electrode C3. The green one is placed exactly in the middle of the distance between electrodes C2 and C4. Electrode C5, the black one, is placed along the horizontal line, perpendicular to the patient's lying position, along the anterior axillary line, and the electrode in position C6. For this, it is sometimes necessary to move the patient's arm along the mid-axillary line. After this, we ensure that the ECG recording is proceeding normally.